The CDC is warning about a rise in RSV cases in babies every year. RSV infections cause about 2 million doctor visits, 80,000 hospitalizations, and up to 300 deaths in children under the age of 5. So what are we seeing here? Hunter Alcocer spoke to the Midland Community Health Services Pediatric Clinic to find out.
According to the MCHS Pediatric Clinic, RSV cases amongst children have been spiking up in Midland. But
in regards to RSV, we're definitely seeing RSV in the community. It's not every child that comes in with cough, congestion, and fever that has RSV, but there definitely has been an uptick over the last month or so compared to kind of what we were seeing in the summer as far as RSV. And it does tend to hit the younger kids a little more than the older kids.
Dr. Klee also says that the spike isn't anything out of the ordinary and in fact is starting to resemble the normal levels this time of year from before COVID. If your child gets sick, at a glance, it can be hard to tell what exactly your child has because things like RSV, flu, and the cold all have similar symptoms. But there are ways you can find out.
So it's difficult to say exactly which one they have until we do certain tests. So in our clinic, we can test for RSV, flu, and COVID, which are all viruses that cause cough and cold symptoms.
Dr. Klee says that if your child is less than 1 year old, then it can be more obvious to tell if they have something like RSV.
Those signs that are kind of the serious signs to watch out for are what we call lower respiratory tract signs. So lower respiratory tract signs would be trouble breathing, such as you might see them working really hard to breathe, so their chest going in and out really fast. You might see them kind of pulling in kind of in this area, the skin going back and forth, and then kind of the same thing under the ribs. Those are the big things you're watching out for with those diseases, is just signs of increased work of breathing.
If your child shows any of these symptoms, it's recommended to immediately contact your pediatrician. Dr. Klee also recommends that during this time of year, parents should help their kids make sure to do things like wash their hands and not constantly touch their face, as well as try to keep them away from any friends or family members that may be sick. In Midland for News West 9, I'm Hunter Alcocer.